Hi, everyone. Today, I'd like to introduce Caitlin Baltzer. She is the co-founder and CEO of MYndspan. She previously held the position of COO at MYndspan. She has also participated in the What If Fellowship. Her previous positions include VP of Strategy and Operations at Croton Healthcare, Associate Investments and Treasury at the Woodbridge Company, Analyst Investment Consulting at RBC Wealth Management, Private Client Associate at RBC Wealth Management, and Market Research Associate at Metapharm Incorporated. She completed a BA in Economics and Administration at Wilfrid Laurier University, an MBA at University of Buckingham, and an MSc in Finance and Investing at University of Buckingham. So Caitlin, I gave a brief introduction there, but wondering if you could tell us your story. I'd love to hear a bit more about your background and your journey to kind of get to where you are today.
Yeah, would love to, because as you can tell by the list you read it out, I'm not an expert in this area. I totally fell backwards really into what I'm doing now. Started my career in investment and finance, was always within wealth management, and then found myself in investment consulting. But I actually always tended towards life sciences and healthcare purely because my dad's always been in the kind of outpatient imaging diagnostics field, but my mom's also a microbiologist, so it was just kind of a constant conversation in my household growing up. I'm Canadian originally. I was in Toronto. I was working within a family office in the investment consulting world and kind of analyzing all of these healthcare companies when it comes to equities, asset management, etc. But just always tended to analyze kind of those in the life sciences and healthcare space. And then I had an opportunity through my own network. My father was actually working on an acquisition, and I started working on the due diligence of this acquisition just as kind of pure curiosity and kind of it was a very cool company that he was acquiring. It was basically a company that manufactured a technology called magnetoencephalography, or MEG for short. And I had never heard of it before. So, through the due diligence process, I learned all about the technology, and effectively, it's just a very big brain scanner that records your brain function and maps that brain function. And learned all about the fact that really it's used clinically in pre-surgical mapping. So it sits in really the most kind of elite clinical environments where, if you needed neurosurgery, they get you into one of these devices, they'd map your function. They would make a surgical plan specific to you to avoid any cognitive deficits. And then they, would make the surgical plan specific to you, but which is cool in and of itself. But there's actually like 35 years of history now to say that when you record brain function with such accuracy, you start to identify these brain connectivity patterns indicative of things like concussion and PTSD and neurodegeneration. So really, I kind of went down the rabbit hole with this technology and really realized that has the potential to be life-changing. And so I decided to leave my job in investments and join the manufacturer of that technology full time after the acquisition, which is where, I was kind of VP of strategy and operations looking at the utility of the technology. And that's kind of, I was there for a handful of years, which is where I met my now co-founder in MYndspan, Yana Hutala. He was actually the CEO who was tasked with divesting the entity, which I was on the acquiring side. So he was sell side, I was buy side. And then we worked together for, I'd say, about 2 years before we really decided that's kind of where we hatched the idea for MYndspan and left to really focus on looking at the data that MEG technology produces and really analyzing it for individuals and using a direct-to-consumer approach with the technology.
Yeah, it sounds like it's been a really interesting journey, and I'm really looking forward to discussing some of the details as we continue our conversation today. But before we hop into the weeds there, I was wondering what sparked that initial interest and involvement in like neuroscience or neurotechnology for you. You mentioned that you've always kind of been interested in life sciences. Were you always interested in neuroscience as well, or was it that discovery of MEG that really like sparked that interest or exploration in you?
Yeah, it really was MEG because, truth be told, like I didn't know really anything about neuroscience beforehand. I've always been in the investments and business world, so it wasn't something that I naturally thought about. I think that neuroscience in general, brain health, mental health, is kind of this really niche area that not a lot of people talk about when it like comes to mental health, for instance. And I think it's really underappreciated. And so, yeah, I had never really even thought much about neuroscience, to be quite honest with you. And then when I learned about MEG and went down the rabbit hole of really like brushing up on the 35 years of research with this, I couldn't understand why this kind of niche technology and the insights that the technology has provided over the last 35 years is not thought about more broadly and is not kind of more talked about, even just in the life sciences, health tech community. So, yeah, it really was just learning about MEG technology because I'm like, before this, I was a complete novice. And yeah, it was really, I always love learning about these things. So, diving into 35 years of research with this is really what sparked the interest.
Yeah, absolutely. And I'm sure there was lots of research to read because, as you mentioned, they've been looking at that tech for a long time and publishing lots of papers about it.
Exactly.
We briefly touched on this already, but now that we know your story, can you give us a bit of background on maybe the origins and timeline of MyNdspan? Maybe how did things initially get started and where do they stand today?
Yeah, so it kind of starts when obviously I met my co-founder Yana when I was within the manufacturer. And one of the things that became apparent was that individuals, like I basically, we wanted to make a product for ourselves. We're neither of us are neuroscientists, but both of us understand the utility of the or the data and the insights it can lend itself to in people's everyday lives. So specifically, we started thinking, well, we were working together just about seeing what was happening, for instance, in the professional sports world. You see these athletes who would sustain a concussion, they would go back to play after completely subjective symptom assessments when really this is a functional brain injury. So it was really seeing what was happening there that got us thinking about the fact that, like, how is accessible brain data like how is it not accessible to individuals? We can wear an Apple Watch now and we can measure our heart rate and understand our HRV, and we can really take control of various different aspects of our health now. But when it comes to your brain, it's just completely inaccessible. And people are making life-changing decisions like when to go back to play with completely inobjective data. So that was kind of what started us talking about the prospect of MyNdspan. We met our chief science officer along that journey. He's one of the world's foremost experts in using this technology to identify and differentiate concussion and PTSD. It works a lot with the Canadian Armed Forces there. And so, really, we started to look at how we can empower individuals with this data to make the best decisions about their own life. And it really, we don't want to be clinical. We also don't want to be telling people when to go back to play, but all we want to do is purely measurize the brain data that comes out of these scanners, and visualize it so people can understand the context and empower them to make the best decisions that they can utilizing this data. So Yana and I started MyNdspan with that mission probably about 3.5 years ago now. And Ben joined us shortly thereafter, leading kind of our scientific endeavors. And so, yeah, we, for the first kind of year and a half, 2 years, we focused on building an automated assessment pipeline utilizing MEG. So it never really been done before. So it took us probably about a year and a half to automate that analysis. And really, we didn't want to be, we also like, we don't like to say that we're a MEG company, we're a brain health company, And this data is not useful in and of itself, looked at within a silo. It's really most useful when looked at clinical context and with cognitive function as well. So what we built is a direct to consumer service. So you'd be able to go now after, yeah, so I would say it's about the first year and a half we were building the technology, and then the subsequent year after that we were testing it. So effectively, you could come into one of our partner scanning sites at Sick Kids Hospital in Toronto, Canada, or in Aston University here in Birmingham, UK. And you would come in, you would do about 25 minutes on an iPad app. Here we collect things like age, biological sex, past diagnoses, any medication you're on, how much caffeine you've consumed that day, but also the three pillars of brain health being diet, sleep, and exercise, because we know that these things can dramatically change the presence of your brain activity. Then you do about 5 gamified cognitive tests, things that measure your short term working memory, physiospatial skills, attention. And then you sit for this completely passive 10-minute resting state MEG scan. So you don't have to change your clothes. You just can't take any metal into the scanner. And you sit there with your eyes open and try not to fall asleep in this completely silent room for 10 minutes. And about half an hour later, we have a report in your email that outlines your localized brain activity, how much activity in your main neural networks, the cognitive output of that activity, but also super importantly, the context within which it's been measured. So understanding what your sleep's been like for the last month, what your nutrition's been like, your exercise, etc. So say about a year and a half of developing that, a year of testing it, and now we are officially commercial, offering these scans in Birmingham. So you'd be able to go on our website and make an appointment for one of those assessments.
Yeah, that sounds like an awesome mission, and it seems like it could be really useful and helpful for a lot of people. And I guess another question that I had about the company framework or the founding of the company is, was there some sort of eureka moment that you and your co-founder had that sparked the idea to start this, or was it slow build up as you kept learning more and more about this deep amount of research and the level of access to this type of imaging and things like that?
Yeah, I don't think there was a specific eureka moment, but it was one of those things where when after talking to Ben specifically just about the use of this data when it comes to athletes who may have sustained a concussion, yeah, and kind of those in the armed forces, that there's really no information for those individuals about how their brain is currently functioning when they are set to make kind of these life-changing decisions, for instance, about when they have to go back to play. But also, it was one of those things where it's like, actually, as I dove more and more into the research about it and the implications of when you start to actually measure your brain activity, look at your brain function, measure it over time, start to get these trend lines. The eureka moment for me was like, oh, like I want this as a product. I want access to this data. I want to make sure that I am healthy. I have family, both sides of my family, dementia and various mental health issues. So it's like, I would benefit from this data. And if I would be willing to pay for it, I started having these conversations with other individuals and realized that there is a market here. And the value of this data is incredible. And so, yeah, that was kind of, it wasn't a specific eureka moment. It was more a slow burn, as you say, where it was really conversations I was having with people and realizing there's a market for this. And people do deserve to have this type of information at their fingertips to make decisions about their own lives.
Yeah, absolutely. That makes a lot of sense. And so MYndspan is a brain analytics company. I was wondering if you touched on this a little bit already, but wondering if you could explain in a bit more detail to the listeners what exactly is being analyzed, and then how does this end up translating into benefit for the users? I know you mentioned that the MEG isn't necessarily siloed, and so it's analyzed in relation to other things. I believe you mentioned like a cognitive assessment and maybe against previous baselines for the individuals. And yeah, just wondering if you could touch a little bit on the analytics side of the company.
Yeah, absolutely. So, yeah, you're exactly right. What is most useful with this is when you look at the MEG data in conjunction with the cognitive function and the metadata, really. And so the analytics side of the company comes into play when you're actually looking, okay, for instance, what is the effect? We just did this recently, but what is the effect of caffeine on the brain, for instance, and how does it impact brain connectivity and brain function? So when we talk about analytics, it's really starting to draw or test hypothesis about exactly what impacts the brain, how does it impact the brain, these various different aspects. So it comes down to what we call the three pillars of brain health as well: diet, sleep, and exercise. We know these things dramatically have a dramatic effect on brain function, brain activity. And so when you start to analyze the brain activity in conjunction with those three pillars, you start to understand, yeah, how it impacts it, and also importantly, where to go from where you are. So like we have an algorithm that looks at the functional brain age. If you go down, for instance, a health kick where you start focusing on your sleep, getting good quality sleep, getting enough sleep, and starting to analyze what the impact is on brain function and the brain activity, you can start to draw conclusions and make, yeah, kind of these plans for yourself to make sure that you're optimizing your health, and yeah, looking at your mental health and your brain health. And so that's where the analytics side comes from, is really starting to, which really hasn't been done before on a large scale, because these machines and the insights that the machine provides has always been looked at in a silo. It hasn't really on a grand scale been looked at alongside this other really useful information. And so it starts to, yeah, the analytics part comes from understanding the, not just measuring the brain, but understanding what impacts the brain and how.
Yeah, it's definitely exciting that you and your company are kind of starting to break down these silos and as well as get this technology out to consumers. And so a follow-up question I had was for any listeners who might not be super familiar with MEG in particular, could you briefly explain in maybe a bit further detail like what this technique is and what sorts of information about the brain it does give us?
Yeah, absolutely. So I always preface this explanation by saying I'm not the expert. So, like, I came to this completely as a novice and learned all about it. But so, the way that I best describe it is that MEG, I guess for people in the industry, it's very similar to EEG, where it records brain activity. But unlike EEG, because it actually goes about recording that activity using measuring the magnetic fields that the kind of the brain is like, it works using electricity. So you're measuring the magnetic field generated by the communications of your neurons. And because it's measuring the magnetic field, it actually is able to locate where that activity is coming from to the millimeter. So we like to say it's millimeter and millisecond accuracy. If you compare it to other modalities like an MRI, which actually takes just a structural picture of your brain and it doesn't give any functional information. What MEG does is it measures and records the brain activity. So I always give the analogy, it's almost like you think about a highway system or a grid system when it comes to cars. So this is what MEG does, like Google Maps for the brain. It measures the amount of activity along the main network. So like think of your amount of cars on a highway. But it also, because it measures kind of the various different brain waves, it can also tell whether it's a transport truck or a Honda Civic, for instance. So what it does is it just creates these incredibly rich maps of function that are specific to the individual. And one thing that we always say is that, yeah, the kind of information it provides in terms, it's like a brain fingerprint because everyone's brain activity, brain connectivity, everyone's individual brain map is specific to them. So it's not, we call it the fingerprint because one fingerprint in comparison to another is not necessarily a good nor bad thing. It's just different. And so that's the same with people's brain activity as well. Everyone's very unique and different. And so it's measuring that activity over time. So if you're measuring the amount of activity on a highway, for instance, and then there's a car accident. So think of it, kind of analogy is like sustaining a concussion. or there's a temporary disruption in that activity on that highway. That's kind of where the value of this technology is and the type of information it provides.
Well, thank you very much for explaining that in further detail. And so we talked a lot about the MYndspan algorithms, and we also talked about the access to this technology that it's providing to the public, or anybody who wants access to it in the regions where you're operating. And so I was wondering, do you kind of see the key product of MYndspan, maybe these proprietary algorithms that are like analyzing the brain data, or do you see it being like the access to MEG, or kind of like a combination of both of these?
It's definitely a combination of both of these things. So the access to MEG, I think, is pivotal because it is just such a powerful technology that when you increase the utility of it and provide more access, you're just increasing, the research that can be done with it, and the conclusions that can be made about brain and brain function. Because I think that we're honestly in a very exciting time when it comes to understanding the brain and starting to figure out kind of brain and mental health, because of innovations within the neurotechnology industry. But yeah, in terms of our algorithms, we have a few that are proprietary to us, and one being the kind of functional brain age. So we are able to estimate based on utilizing just the brain activity measured in the scan. We understand what kind of healthy brain aging looks over a normal lifespan. And so we're able to estimate the age of the activity that we measure and record in the scanner. And so understanding that kind of functional brain age and how that changes over time really provides some incredibly powerful insight about healthy aging. So if someone were to come back every year, you can start to establish your trend line. You can also, because in our assessments, we put this information alongside those three pillars I mentioned, the diet, sleep, and exercise, you can actually start to see and measure the impact that your lifestyle is having on the functional age of your brain, which is incredibly powerful information to have when it comes to optimizing that kind of, the long, healthy lifespan of the mind. We also have another measure, we call it the Brain Stability Index. So this anecdotally, I say it measures the structural integrity of those networks. So those highways, for instance, in your brain. We find that the stability is not necessarily impacted specifically by lifestyle measures. We find these things are more affected by structural events. You do see that suffer if someone has a concussion, for instance. So yeah, those algorithms are definitely, that's kind of the value add of MindSpan, of when you don't look at these things in a silo as well. When you start to incorporate this other information that we collect, the cognitive function, the metadata, those three pillars, and start to kind of combine all of those into these algorithms, it starts to become incredibly powerful.
Yeah, I totally agree about like how these multimodal algorithms can really add a lot of power to the either conclusions that you're making or things that you're analyzing. It's really like a 1+1=3 kind of situation with these type of algorithms. And then talking a little bit more about framework of MindSpan, the customer experience, is this something that the customer would go in for out of pocket, or is it health expense? How does that part of the situation work?
Yeah, so at the moment, we are pay out of pocket. So we like to say that, give the analogy that we're kind of like a Apple Watch type model where we measure this information and empower people with it. We do not give any clinical or medical guidance. We purely kind of visualize this information, and provide it people to take down their own, whether it's clinical pathway, or just to optimize kind of their lifestyle. So at the moment, we are pay out of pocket.
Yeah, that makes sense. What countries or regions is MindSpan currently operating in?
So currently we are in Toronto, Canada, and here in Birmingham, UK, and are working on hopefully soon expanding that presence. But yeah, we have two partner scanning sites at the moment, which is where we offer our services in Canada and here in the UK.
Well, definitely exciting to hear about the upcoming potential expansion.
Yes, we're very excited about it. I mean, at the end of the day, our entire mission is to increase the accessibility of this data and the technology. So yeah, we're excited to expand our presence.
Yeah, absolutely. Absolutely. A lot of the listeners of the podcasts are interested in either founding their own neuroscience or neurotech company or potentially like joining a startup. I was wondering if we could discuss a little bit about what your role within the company looks like. And so the first question I had about that is how does your previous background in things like investments, banking, market research, strategy, and ops, etc., help inform your decision making as an executive at this company? Do you see a lot of parallels between this market that you're in and maybe some of the previous types of markets you've been exposed to or analyzed?
We operate in the neurotech area, but I would say there's no real parallels. I think the only real it's just a breadth of different experience and given strategy and operation investments and seeing various different business models, various different markets, but also various different cultures and different companies. It basically provided me a really good background for having a not a full grasp on everything, but like a kind of real breadth of experience to decide to go into this. And so, and more than anything, I would also say it gave me an opportunity to look at various different companies and industries that I found I was passionate about or not. There were certain companies or in different areas that it didn't kind of spark that interest in me, that passion. When it comes to like my background in analyzing various different equities. Yeah, so I would say it really allowed me to figure out what I'm passionate about, which is neuroscience, which is MEG, which is kind of this consumerization and democratization of healthcare data. And so, yeah, it was all kind of a long, winding path that led me here with, yeah, no real end goal, really. I just think that having such experience across a broad range of things really helped me kind of get, yeah, just different experiences that I've leveraged every single one of them as being a startup founder. You definitely need to not only understand the market and the technology, but understand how to do everything to taking out the garbage. Like you're kind of a master of all trades. So that background definitely helped.
Yeah, it seems like this chance that you had to kind of explore lots of different industries and learn about lots of different markets can really be useful, as you mentioned, because as a startup founder, you have to do a little bit of everything. I noticed that you recently transitioned from COO to CEO
Yeah.
at your company. And so I was wondering, how was this transition and like what have you found to be some of the key differences between these roles at the company?
Yeah, it's a good question. So when Yana and I first started this company, this was kind of always in the plan. He is an incredible mentor and specifically said that the first kind of few years, we were going to tackle this together. And he's been, yeah, he's had a variety of different CEO hats over the years. And so, yeah, I've been incredibly lucky to have partnered with him and have this kind of mentor who's guide me on, yeah, going from the COO, kind of building the team and operating to taking on more of a leadership role within the company. So it's been pretty seamless transition, to be honest. And I think it really does allow us to also really flourish in the areas that we both kind of are really passionate about. So Yana's one of the you don't kind of get more experience than he has when it comes to understanding MEG technology specifically, and also neuromodulation and understanding the market and all of the kind of different entities and stakeholders within that very kind of high level view. And whereas I come to this, like my passion became developing a product that I am ultimately a consumer of. And so yeah, it allowed us to really kind of have a seamless transition of yeah, taking on those various different roles and training for it over the last 3.5 years.
Yeah, it sounds like it really has been a smooth transition, and it's definitely important to have those mentors and people to help guide you. And it sounds awesome that you've been able to find such a great mentor and your co-founder and former CEO.
Yeah, absolutely. Couldn't agree with you more.
For maybe some of our listeners who might be interested in starting a startup in the neuroscience or neurotech space someday. What's the day-to-day like for you as a CEO in this space?
Good question, because it depends on the day, whether it's kind of an admin heavy day doing contracts and the boring stuff versus going out there and selling the product versus raising capital versus in the weeds with the tech team actually building the product. The days are never the same. And what I would say, advice anyone looking to get into the industry is that a and this is something I like am very heavy proponent of. There's no such thing as stupid questions. No one knows everything in this industry because it's also just such a nascent field. The people are only now really starting to discover the brain and how it functions. And yeah, you see that with the proliferation of tech devices and neurotech devices coming to market. Being able to ask dumb questions, being able to go out and talk to whoever it is in the field. I'm a very big proponent as well as collaboration, even when it comes to competitors sometimes. And just it's one of those things where because it's such a new field, I also think that a rising tide lifts all boats. And the more you kind of brainstorm together and chat and understand kind of where everyone else is in the market and what they're trying to accomplish, the better. And so, yeah, I came to it with zero background. So being able to kind of be really naive and ask dumb questions and talk to everybody and kind of hoover up as much information and knowledge from some of the superstars in this industry, it was really, really important for us and for me specifically in my kind of understanding of the marketplace.
Yeah, that does sound like great advice, to really ask a lot of questions and build a community and brainstorm and all these sorts of things. Rising Tide really does lift all boats, and I think sometimes these collaborations can end up being really important.
Yeah, no, I agree. Yeah, because it's one of those things where you don't also realize what uh, innovations and ideas come from having these conversations with someone who might be operating even on the face of it as a competitor. But yeah, I think there's so much unexplored space in this industry. Being able to have those conversations is really important.
Yeah, there definitely is still much to explore and much to discover in the space of neuroscience or neurotech.
Yeah, I completely agree.
And so you mentioned a bit about competitors, and I was wondering, what kind of space do MyndSpan's competitors work into? Are they also doing MEG, or would you say the competitors are more so other companies doing like brain analytics from another angle? And what would you say necessarily like differentiates MyndSpan from these other companies or from these other competitors?
Yeah, I think it's a good question. Really, there's ultimately we're in a direct to consumer market, so any other use of funds for a consumer is going to be a competitor of what we're doing. I think the thing that does set us apart is MEG, is the technology we're using. I don't know of many other companies that are using MEG technology to generate consumer reports and going direct to consumer. I think that's definitely the value that we bring, and our core focus is on educating people about the brain data and visualizing it in a way that someone doesn't have to have a background in neuroscience or even healthcare to take away some value from our assessments. And so I think that is our main thing. But really, yeah, it's one of those things where it's like even preventative whole body MRI, you can see that as a competitor. Offers completely different information that we provide, but at the same time, it's in the kind of preventative medical space, which argue that is a competitor of ours. But yeah, so I mean, there's many different ways that you could look at the business model and identify a competitor. But at the end of the day, I think the best response to that is also to collaborate and, yeah, figure out kind of where the niche is With us, it's just the direct to consumer MEG.
So to the level that you're comfortable talking about or comfortable discussing it, what's next for MYndspan?
Yeah, what's next is expanding access to our service. So we are hoping to have some exciting announcements this year on that front. At the moment, we have just opened public booking for our assessments in Birmingham, UK. So you can now just make that appointment right on our website and go in and get one of these assessments. And we are hoping to expand that service soon and new locations.
Well, that's super exciting, and I'm looking forward to those announcements in the coming months or over the next year or so, seeing these new locations pop up.
Yeah. Yeah, you and me both. So yeah, we'll have to get you over from Cleveland to the UK in the next
Yeah,
couple months.
yeah, that'd be great. I'd love that.
For
Um,
sure.
and so before we pivot to talking about a few other topics, I was wondering if there's anything else you'd like to mention about MindSpan.
No, I don't think so. Apart from, yeah, feel free to make yourself an appointment from our website and come in if you're in the UK to get one of our assessments.
Sounds great. Now to make a quick pivot, and we touched on this a little bit already, but I was wondering what advice would you give to perhaps students or young professionals aiming to work in the field of neuroscience or neurotech? And I think especially something that would be useful would be advice for maybe those who might have a background in the space of like business or banking, like you do, who are kind of trying to make a pivot more towards this life science type of space.
Yeah, I think my only advice would be, and I wish someone had told me this when I was in school, that you don't have to have this perfect plan and well designed. I think if you, yeah, sometimes it closes doors along the ways to different opportunities that could be helpful. I think if you are very dead set on a specific end goal, I guess. And so I would just argue that you want to be open to a whole bunch of different opportunities and follow what actually gets you excited. Because working on something for kind of 8 to 12 hours a day makes a world of difference if you're actually really passionate about what you're working on. And so, yeah, it's just to have a whole host of opportunities. I always say don't pigeonhole yourself in something. If something is interesting, get some more experience in that realm. Yeah. And I would argue a breadth of different experience and exposure to different industries and companies is always a good idea.
Yeah, that sounds like amazing advice. To be honest, I wish somebody had given me that advice when I was in my undergrad years, and it really does resonate pretty strongly with me.
Yeah. No, you and I both. Yeah. I was so kind of focused on the end goal when I was going through university and I thought I had this specific charted out path for myself. And yeah, if I had kept going down that pathway, I wouldn't have ended up where I am now. And I absolutely love what I'm doing and I love what I'm building. And I learn something new every day and I get excited by something new, maybe not every day, but every week probably. And yeah, that makes a whole lot of difference.
Yeah, it seems like it all worked out for the best though, and that sounds like a really awesome spot to be in where you're really able to kind of keep keep learning and keep getting excited by these new things.
No, I agree with you there.
And so to zoom out a little bit more, do you have any predictions for the field of neurotechnology over the long term, maybe the next 20 years or so? And, this could be kind of like in the subset of the space that you're already working in, or if you want, it could even be about like maybe zooming out even further in the field of neurotechnology at large.
Oh, I wouldn't even attempt to predict what things are going to look like in 20 years. I think, yeah, I wouldn't even have an educated best guess, given what's happened with AI in the last year. Um, yeah, I think some incredibly exciting things are going to happen in the next handful of years, really. Things are moving so fast, but I think yeah, it's going to be non-specific, but I really do think we're going to start to understand more and more about the brain and how it functions because I would argue that we still really don't understand the brain. It is the most complicated organ. Yeah, it's it's interesting because if you look at where we were with cardiology and oncology back in like the 60s, and really we have made some incredible strides. I would argue that we're just at the beginning of where we are with like cardiac health in the 60s when it comes to the brain. And so I'm really excited to see what's going to happen in the next 20 years. I think one of the things will be yeah, if you look at what's happening in like the TMS and transcranial direct current stimulation and the some vagal nerve stimulators, the kind of commercialization of that technology outside of medication when it comes to brain and mental health, I think there's some really exciting things happening in that space. And it's one of those things where I think we can see that it works, but we don't really necessarily understand why. And so I think in the next 20 years, we're going to start to understand why some of these things, like, yeah, TDCS works so well and really start to bridge that gap in the knowledge. But yeah, it's going to look dramatically different in the next 20 years. That's my only main prediction.
Yeah, I totally agree with you. And I think we really do have a lot to learn about the brain still. And I'm excited to see the discoveries that really do happen over these next 20 years or so. And, all the new things that hopefully will be figured out. And I know you mentioned there's been a lot of recent innovations in AI, and I think that really has the potential to supercharge the things we can learn about the brain, and just the things we can learn about other things, just because of how powerful it can make these things like data analysis and such.
No, I completely agree with you. Yeah, if you look at it through the lens of AI and all these like learning language models as a tool just to kind of, yeah, increase the speed with which we can discover some of these things, it's really exciting.
Yeah, absolutely, absolutely. And as we head towards the conclusion of the episode, is there anything else that we haven't discussed that you'd like to mention or bring up?
I don't think so. Other than to say we're a super collaborative group, and like I said, I love to talk to others in the space. I love to, yeah, chat about what we're doing. So, yeah, people can book appointments on our website if they want to come out to Birmingham to get a assessment. Stay tuned because we will have some more exciting announcements later in the year. And yeah, if anyone's interested in learning more or yeah, collaborating, yeah, we're a super collaborative group, so feel free to reach out.
Yeah, sounds great. And I'll be sure to link the website on the show notes so it's easy for people to get to. And in terms of reaching out, you mentioned you'd like potential collaborators to reach out, for example. How can they reach out to you? And is there any specific sort of collaborations you had in mind, or kind of just any idea that people have open to hearing it?
Any idea? I'm always open to hearing it. And yeah, they can reach out to me just at Caitlin@MYndspan.com.
Sounds great. Well, I just wanted to say thanks again for coming on today. I feel like I learned a ton from you, and I'm really
Thanks.
excited about your technology and your company, and yeah, it's been an awesome conversation, and I really appreciate it.
Oh, thanks so much, Robert. It's been fun.